Good morning, Lady Patience E. Hey, Mr. Clifford. He says, what I look for in a friend is actually loyalty, honesty, God-fearing, understanding, caring, reliable, trust, and values me as a friend. You should be able to have a friend who values you. Very important, who understands that the reason you're in their life is for something important, and they understand that. So that was it for our question of the day. Please keep sending your responses as the show goes on. I'll gladly read them, because as we list these things, people slowly understand what they should be if they want to be good friends. That said, it's time for us to move into our focus of today, Parkinson's disease. Why are we focusing on that today? Because it's World Parkinson's Disease Day. And in order to understand why it's being commemorated today, we need to go down history lane. And thanks to Juliana Befolo, we'll be doing that. It was actually in 1817 that a British doctor, James Parkinson, discovered and wrote a medical essay on a health condition that caused involuntary tremulous motion. That is, you don't know why, but your hand, for example, is shaking or your head is shaking. You can't understand it. So he was intrigued by it, and he did some research on it. The illness was later named after him, Parkinson's disease. So Juliana Befolo takes us through history and the basic knowledge we need to have on Parkinson's. Immediately after, we'll have a rich conversation with a health expert.
The Parkinson's disease is a progressive disorder that affects the nervous system and the parts of the body controlled by the nerves. The disease signs and symptoms differ from one person to another, and the early signs may be mild and go unnoticed. Such symptoms often begin on one side of the body and usually remain worse on that side even after symptoms begin to affect other body parts. Some of the most common symptoms will include tremor, which is a rhythmic shaking which usually begins in a limb, often your hands or fingers. You may rub your thumb and forefinger back and forth. This is known as a pill rolling tremor. Your hand may tremble when it is at rest. The shaking may decrease when you are performing a task. Slowed movement or bradycardia is another symptom of the illness. Over time, Parkinson's disease may slow your movement, making simple tasks difficult and time-consuming. Your steps may become shorter when you walk. It may be difficult to get out of a chair. You may drag or shuffle your feet as you try to walk. Rigid muscles or muscle stiffness may also occur in any part of your body. The stiff muscles can be painful and limit your range of motion. Loss of automatic movements. Here, the patients may have a decreased ability to perform unconscious movements, including blinking, smiling, or swinging your arms when you walk. In addition to the just stated symptoms, patients will equally notice impaired posture and balance, speech changes, and writing changes. But however, the question remains as to what is the veritable cause of the disease. According to medics, the cause of Parkinson's disease is unknown, but several factors appear to play a role, including heredity. Having a close relative with Parkinson's disease increases the chances that you will develop the disease. However, your risks are still small unless you have many relatives in your family with Parkinson's disease. Gender. Medics hold that men are more likely to develop Parkinson's disease than women. Also, exposure to toxins such as herbicides and pesticides may slightly increase your risk of Parkinson's disease. Also, genes, environmental triggers, and age are not left out as causes of their disease. It is important to note that Parkinson's disease can't be cured, but medications can help control the symptoms, often dramatically. In some more advanced cases, surgery may be advised.
Here to respond to our questions and help us go through the realities of Parkinson's patients right here in Cameroon is a neurologist at the Yaoundé Central Hospital. We're glad to welcome Dr. Leonard Gaka. Good morning.
Thank you very much, Patience. Good morning.
Thank
it's a pleasure
you so
for me
much
to be here this
for
morning.
coming this morning. We're truly grateful because I need to set the stage for this. I feel deeply concerned about this and slightly even emotional because my grandma suffered from Parkinson, so I have lived and I've seen the realities of someone going through something they don't understand. And the
Right.
worst part of it is when people around you don't even understand what's wrong with you.
All right.
But then the opportunity is here today for us to be educated by a health expert. Please seize it. Now, that was a report by Juliana, just to set the stage. Talked about the causes, the symptoms. Are there anything you may want to add to what she said?
Yeah, I think I'd just like to add that Parkinson's disease, it's a neurodegenerative disorder.
Yeah.
And its prevalence has been on the rise in sub-Saharan Africa, especially due to the life expectancy has been increasing.
Okay.
I'll add that the prevalence shows that out of 100,000 people, there are 230 of them will have Parkinson's disease. And studies we've carried out in the Central Hospital in Yaoundé, we have a hospital prevalence of about 7%. In fact, I would go further to say, just yesterday, during my outpatient consultation, I saw about 15 patients in total, and 3 of them were newly diagnosed. It means I diagnosed them of Parkinson's disease just yesterday before midday. Just to say that it's not as rare as people think. It's a disease that is common in our population. And unfortunately, like any other neurological disorder, they face a lot of stigma. People do stigmatize them and they attribute them to witchcraft and other things. I want to say that Parkinson's disease is a health condition. The person didn't buy it, he did nothing to earn that. It's just a condition that could happen to anybody. And it's so invalidating that we shouldn't stigmatize them or make an already bad situation worse. They need support from us, and so we should give them the assistance that they need in order to help them lead a comfortable life.
And that comes from understanding. When you talk about a neurological disorder, what does that actually mean?
Actually, it's a brain disorder. What happens with Parkinson's disease is it's a neurodegenerative disorder. When we say neurodegenerative, it's aging of particular neurons in a part of the brain. They call it the substantia nigra. That part produces a substance called dopamine. Dopamine helps in rendering movements fluid, and in fact it makes movements easy. And how does it make movements easy? One, by reducing tremors when you are at rest, and also to fluidify the movements. Now, because of the aging of those neurons, they can't produce dopamine anymore, so consequently movements are no longer fluid, are no longer eased as they were supposed to be. So the person has tremors which are at rest, and aggravated when he's in deep thought or when he's angry. And he also has bradykinesia and rigidity. He gets so stiff. Just like it is said in the celebration this year that Parkinson's disease is more than motor symptoms. What I described above or earlier are motor symptoms. These patients have beyond motor symptoms. They have other non-motor signs which are greatly invalidating. And these non-motor signs could affect different systems of the body. First of all, why do you have non-motor signs? It's because the brain is the master controller of the whole body. And so any disease that touches the brain could touch many other systems. So these non-motor signs will be, let's take for example, for the brain, you will have problems with sleep, insomnia, and REM sleep disorders. For the cardiovascular system, you have orthostatic hypotension, which means a sharp drop of your blood pressure when a person leaves from sitting to standing, and this could cause several falls. Apart from the cardiovascular manifestation, you have urogenital manifestations like sexual dysfunctions, you have urinary retention, and for gastrointestinal signs, we have constipation, and so on and so forth.
So all of this could affect someone suffering from Parkinson's?
Oh yes, all of that could affect some. In fact, sometimes the symptoms even start with the non-motor signs. In fact, the person could even lose olfaction. He can't get smell anymore. And yeah, those are very early signs of Parkinson's disease.
Let's talk about these early signs. What are some of them?
So these early signs are these non-motor signs I'm talking about. The first sign could be just loss of sense of smell. It's very common, and chronic constipation. Yeah, those are some signs that people with Parkinson's disease might have before the onset of the motor signs, which are tremors, rigidity, and akinesia. When we talk about akinesia, it means difficulties moving. You will see a patient just has a flat face, he doesn't smile, he just there.
Yes, and you don't understand that he's going through something. It's not voluntary. Okay, is it like something that affects you only when you're aging? At what age would you have Parkinson's? Or it can happen to anyone.
Yes, Parkinson's disease, the main risk factor for Parkinson's disease is age.
Okay.
But apart from age, there are many factors which contribute to developing Parkinson's disease. They call them risk factors. And apart from them, we have exposure to pesticides, insecticides, and also some fertilizers. They have substances which go and favor the generation of these brain cells.
Yeah.
So apart from that, we also have studies which show that alcohol and smoking could have an impact on developing Parkinson's disease. That means it favors the development of Parkinson's disease.
Okay, all of these things are important for us to know. Then it's also important that you highlight how it progresses. What are the different stages we should know of?
Yeah, Parkinson's disease progression, there are three main stages. The first stage is what we call the honeymoon phase. This is the phase where the symptoms are mild and the response to treatment is superb. I mean, the patient takes treatment and feels really good. It usually lasts about the first 10 years.
Yeah.
And after that, we have the next phase is the fluctuation phase, wherein the patient takes drugs and there are periods where he has tremors when the drugs get finished in the blood. And the last phase is the phase of complications, wherein the disease progresses with rapidly. There is degeneration and the symptoms are at the max, and sometimes treatments don't work anymore at this stage.
Yeah.
That's where we could sometimes use other modalities of treatments like deep brain stimulation to help these patients.
So there's no treating, like getting completely healed from Parkinson's. That's not possible.
Yeah, given it's neurodegenerative, we can't talk about treating.
Yeah.
You can't treat aging. But there are drugs available which help to modify.
Manage.
Yeah, and they call them disease modifying drugs. So it really helps to slow down significantly the progression of the condition. And that's why when someone, if someone is diagnosed early with Parkinson's disease, he needs to be started on treatment so as to slow down significantly the progression of the disease and help improve his quality of life.
Okay, so Dr. Leonard Ngaka is going to stay with us. I want you to follow the story of a certain Mr. Hilaire Roger, who is living with Parkinson's, but he's living in strength because he's motivating others to live a fruitful life despite this illness. He has a Parkinson's support group initiative he'll be telling us about, but most importantly, is for you to see the life of someone living with Parkinson's, thanks to Juliana Bafolo.
My first symptom was the slowness of movement I noticed with my right leg. By then, I was working in a basement camp in charge of the restoration of 120 persons. I faced difficulty in wearing a pair of slippers or when buttoning my shirt.
He, Hilaire Roger, has been living with a rare disease for about 10 years now. The father of three still freshly remembers when his diagnoses were given him.
It was only on the 13th of April 2013 that my final diagnoses were presented to me after over 3 years of clinical parkour. Because the illness is very difficult to diagnose and the symptoms of this illness is most often associated to other sicknesses.
The disease in question is the Parkinson's disease, best known as the shaken sickness. Recounting his story, Mr. Hilaire told Cameroon Feelings team that the early signs were attributed to several other beliefs.
The first medics told me lots of things, from me having a heart attack in my sleep. Others said I had a clot of blood in my brain, and even more. But today I greatly understand them.
Like it is usually said, no one refuses his or her fate. Mr. Hilaire had no choice rather than accepting his fate on the rare kind of disease not familiar to Africans or the African continent.
L'accueil du diagnostic a été très difficile à accepter.
It was very difficult to accept the diagnosis, but I had no other choice rather to accept it. I read a lot to inform myself. When I was diagnosed, I went to the internet because the medic just told me I was detected of the Parkinson's syndrome and no further explanation. explanation. He asked me to buy some drugs and come back in 3 months.
His whole social and family life was, is, and has always been affected by the appearance of the Parkinson's disease. It even led to the separation of him and his beloved wife.
Take 4. It was very difficult to accept the diagnosis, but I had no other choice rather to accept it. I read a lot to inform myself. When I was diagnosed, I went through the internet because the medic just told me I was detected of the Parkinson's syndrome and no further explanation. He asked me to buy some drugs and come back in 3 months. Take 5. The Parkinson's disease is one which slows down the steadfastness of life. Why do I say so? The disease makes you abandon almost everything about social life. Just because you are shaky, you withdraw yourself from others. The rigidity does not even permit you to go outing with your kids, because your kids start asking you questions like, "Daddy, why are you shaking?" Such questions make you undesirable. My wife was in the superstitious part and stigma related to the illness. She was more of its witchcraft. So we did not understand each other because I'm a very scientific person. The other aspect is that the disease modifies the psychic aspect of a person. You develop a feeling of unsatisfaction, that is the invisible part of the Parkinson's disease. The first year of the illness, I became so depressed and discussed the departure of my beloved wife.
Nonetheless, Mr. Hilaire has his 3 kids by his side, and the youngest of them is his full-time assistant. A Parkinson's patient must be assisted all day long.
Je suis donc venue vivre avec lui. J'avais 12 ans.
I began living with my dad when I was 12 years old. It's at that age that I became conscious that my dad was sick and it was my responsibility to take care of him. I knew I wouldn't be a normal child. In my routine, I include my dad in everything I do. It's not like he does nothing for me, but I know he needs more help to wake up, drink water, and even more.
He has braved the stigma that comes with the illness and today fights for other peers of his kind who suffer from same disease by sensitizing families and some persons sick of the disease. Himbe Hilaire Roger is today CEO of the Parkinson Support Group Cameroon.
A big thanks to the Actions Group, Frank's Parkinson and Parkinson Canada, who guided me and are the main reasons for creation of the support group, which permitted me to forget my own sufferings. Now I care for others. Today I count 18 patients to whom I explain what the illness is about, and today several of them live a better life with their families.
It is worth noting that Mr. Himbe Hilaire Roger, apart from him being assisted by his entourage, strictly follows a medical routine which demands of him to take 6 pills per day, 2 in the morning, 2 in the afternoon, and another in the evening. This permits the reduction of the symptoms of the disease. His family joins him to bid a joyful goodbye to the Cameroon Feelings team.
Thank you so much, Juliana Befolo and Mr. Mbe, for opening your doors to us so we can visualize everything the doctor is sharing with us this morning. Dr. Ngaka, as we've seen through Mr. Mbe's life, this disease affects lifestyle a whole lot. How does it do?
Yeah, it affects significantly the person's lifestyle. First of all, just the mere fact that the person is unable to move himself, it's a serious handicap. to a point where some patients are unable to turn on the bed in the night. So he wants to ease himself, he can't, he's just stuck on his bed and might need someone to carry him from there to go ease himself, or he has to be on diapers. That's serious. And you can imagine moving from there, the person might be unable to carry on his usual activities like bathing because he's so stiff and he can't go out for a walk, and consequently some of them might not be able to walk in very advanced cases. In fact, when the disease gets so advanced, the patients get bedridden, and this has significant psychological and economic impact on the patient and on the family. And that is why I'll still hammer hard on stigma, because imagine living with someone who is unable to help himself. I mean, before now, he was healthy, strong, and carrying on all his activities, and suddenly he can't do that anymore. He's stressed up, and his whole family is stressed up as a result, and then people add to their stress by accusing them of witchcraft. I mean, it's terrible, and I'd like to take this opportunity to encourage all Cameroonians that people who suffer from neurological disorders have not been infested with evil spirits. It is actually a health condition, and they need a lot of support. So let's support them, let's encourage them in whatever way that we can.
How can family members or even community members support someone with Parkinson's disease?
Yes, I think first of all, they could have financial support. First of all, the drugs are generally very expensive. Averagely, a Parkinson's disease patient from very early phases might spend about 30 to 40,000 francs monthly on his drugs, and as the disease progresses, he could spend even up to 100,000 francs. And in that light, an organization I work with, we've applied to World Parkinson's for support, and we're making available for us some drugs, medications which we can support, we can give to these patients with Parkinson's disease free of charge in order to alleviate the financial burden of buying these drugs on these patients. So I think the consignments have surely arrived, and I'll be clearing them one of these days in order to help just distribute to these patients so as to help them.
And then there should be a lot of patients as well, because these are people who are able to live their lives, and now they have to depend on you, not willingly.
All right. Exactly. Exactly. There are lots of patients because, I mean, people now have to depend on them. Yeah. So it's serious.
Okay. Before we have a look at Guy Deacon's story, he lives with Parkinson's disease, but then he's on a mission to travel around Africa, educating people on this disease. Before then, I want your final word to Cameroonians. What should we know about preventing Parkinson's and also living with it?
Yes, my final word about preventing is let us minimize the risk factors by minimizing the use of pesticides, insecticides, and we should use only validated fertilizers on our farms. In fact, we should use them only if we must use them. The next thing is we should avoid alcohol and smoking because they all are risk factors, and also head traumas because head trauma is a major risk factor for Parkinson's disease. It's a risk factor for Parkinson's disease, like we could see with someone like Muhammad Ali. So those are the major things we should avoid. And to the community about it, let's support the patient. The patient, it's support. I think I can't emphasize that enough.
Yeah, thank you so much, Dr. Ngaka, for coming here, and hopefully you can come back because there's a lot more we can learn. That said, I'm sure you have gotten the basics of Parkinson's disease on this World Parkinson's Day. The most important thing you need to remember, especially with our cultural tendencies, is stop accusing people of being witches because you don't understand what they're going through. You can't add to the pain of not understanding why they can't be as they used to be. And it's a thing that could happen to you as well. It's part of aging. So let's be kind. Right now, it's time for us to have Guy Deacon's story. I kept calling him Guy, but it's Guy Deacon. He's a British man living with Parkinson's disease, but traveling around Africa telling you and I about it. Take a look. So, welcome to Cameroon, Guy Deacon.
Thank you very much.
How long have you been in Cameroon so far?
I've been here about 10 days now.
Okay.
So a short while.
Yes. How has your experience been?
Well, it's been an unusual experience because, of course, what the audience doesn't know is I broke down before I even got to the border.
Oh.
My poor vehicle's got a clutch problem, so I ended up being towed across the border and then transported on the back of a lorry down from Banyo all the way down to Yaoundé. So
Yes.
I've had a different experience of Cameroon so far.
Okay, we're going to talk about the reason why you are in Cameroon. What brings you here and around Africa?
The story goes back quite a long way. I travelled to Africa first in about 1982 and fell in love with the continent because it's
Okay.
an extraordinary place with so much variety and so much wonderment.
Yes.
And in '87 I did a trip from the UK to Kenya, and I met an American couple who were doing the trip from Morocco all the way to South Africa. And I said to myself then, this is '87, I'm going to do that myself when I get the right amount of time. So I've always had this ambition to revisit the continent and travel all the way through all the countries to get to the southern tip of it.
Yes.
And that's what I'm doing.
But this mission is led by another cause altogether. Besides you visiting and loving the continent, which we genuinely